Good morning, everyone. Welcome to this month's coffee break with Greenwald. I am Sarah Rubenstein, a director of healthcare research here at Greenwald. I'm joined by my colleague Alex Rather, senior associate today. If you haven't been to one of Greenwald's coffee breaks, first off, welcome. But we like to sort of keep these informal, really sort of a conversation. So if you have any comments, thoughts, questions throughout, just feel free to unmute and ask them, or you can put them in the chat. Obviously, we'll have time at the end for further questions and discussions. But again, if something pops up, feel free to sort of just interrupt. Today's coffee break, we're going to take a look at the 2024 Consumer Engagement Healthcare Survey. Now, this is a pretty dense study with a lot of interesting data. Wish we could talk about it all, but for the interest of time, we're just going to focus on a few new sections and sort of dive into some of those sections where we've sort of dug a little bit deeper than we have in the past. Now, the Consumer Engagement Healthcare Survey is a study that we do with the Employee Benefit Research Institute. This is the 20th year. This year, we interviewed 2011 Americans ages 21 to 64, and these are folks who are on private health insurance, so whether that's buying directly or through an employer. This year's survey fielded in the fall, and the data was weighted by gender, age, income, ethnicity, education, and region. Now, if that number, that 2000 number, seems a little high to you, if you've sort of seen our work on this study in the past, we had an oversample of high deductible health plan members and sort of a lower national sample. This year, we just sort of overall increased that national sample. And next year, we will have an oversample with African Americans, and this is to align with the other oversamples that we do with the other projects with EBRI. So sort of moving forward with 2025, we're going to start having demographic oversamples. So just sort of wanted to sort of put that out there if that number seems a little different to you, if you have seen our work on this project in the past. So this first section that we're going to take a look at today is on health plan literacy. We do have questions that we've asked in the past and asked again this year, where people sort of give their self-reported plan understanding. So we have a question where we ask, how well do you understand the plans that are offered to you? And every year people respond like very well or somewhat well. In fact, like about a third say that they understand the plans that were offered to them very well, another half somewhat well. But we wanted to dig deeper into that this year by, instead of just looking at their self-reported understanding, but asking sort of direct questions to sort of gauge how well they actually understand. So this first slide here is a new question where we asked a series of true or false statements. So we asked folks questions about deductibles, out-of-pocket maximums, prescription copays, and monthly premiums. And overall, it's kind of varied. People generally understood how deductibles and monthly premiums worked, but confusion sort of arose when we asked them about out-of-pocket maximums, sort of different prescription copay pricing structures. Overall, about half of people who answered this question, what we call passed, which is answering 3 out of the 4 correctly. And high deductible health plan members did do a bit better than the traditional plan members when it comes to answering 3 out of the 4 correctly. We also asked this question about HSA, sort of same sort of structure. So in the true or false statements for health savings accounts, we asked them about paying for medical expenses in retirement. If they leave their job, do they lose that account and the money in it? Can the money in that account be invested into mutual funds? And can anybody open it regardless of plan type? And they did worse here than they did sort of on the overall health plan questions. Only 25% of people answered 3 out of the 4 correctly. They did a bit better in understanding that you can use this money in retirement and knowing that you can keep this money in the account if you do leave your job. But fewer understood that you could invest this money and that you couldn't open it regardless of the plan type. Those who had a high deductible health plan did do better than traditional members, but it still was pretty low. which is unfortunate. We would want that number to be higher. But it's not that surprising. Actually, we have another question in the study where we ask of those who were offered a health savings account but didn't open one, why didn't they not open it? And one of the top answers is that they didn't like the use it or lose it rule, which does not apply to HSAs. So I think that, looking at that question and the two that we just looked at here, there definitely is some sort of disconnect going on. People feel like they understand what's offered to them, but when asked, they don't. There's definitely some confusion going on here. I think there definitely sort of is an opportunity to teach people and to make sure they're really understanding what's offered to them and how to use their plan. And this next section that we're going to be looking at is on rising healthcare costs, which I know is sort of a hot topic right now. And so this first question is a trended question, but I want to sort of give it as a baseline. We ask folks over the last year, like, have your costs increased? About half say they stayed the same. Very few say that it's decreased, but 44% this year did say that their cost increased over the past year, which is up from 40% last year. And we see high deductible health plan members report this more than the traditional plan members. So where are these increases coming? As we've seen in previous years, the top answer is the insurance premium, followed by deductibles. And the high deductible plan owners were more likely than traditional plan owners to say that the increase that they saw was in their deductible and in their out-of-pocket maximum. Now, one thing that I do want to point out that sort of is interesting to me, and I think that, some of the next questions that we're going to look at sort of may answer this for us, but I find it really interesting that their reported overall satisfaction with their plan is high and increased this year. It's about 62%. And the overall satisfaction with their cost of prescriptions and the cost of their out-of-pocket spending is high and increased from last year. So more people are reporting an increase in cost, but they're also sort of satisfied with the cost. So one thing that I like to think about is, well, then how is that actually impacting their thoughts about the plan? So a new question that we asked this year is, if everything else stayed the same with their health plan, but their premium went up, how likely would they be to stay? And as you can see here, there definitely is some willingness to stay with their plan, but pay a higher premium. Just over half said that they would be likely to stay with their plan if they had a 5% premium increase. That drops down to about a third with a 10% premium increase, and then drops down even further to about a quarter with a premium increase of 15% or more. And we also asked this question about deductibles, and we pretty much get the same exact answer. About half would be willing to stay with their plan if their deductible increased about 5%, about a third with a 10% increase, and about a quarter with a deductible increase of 15% or more. And there were no plan differences with this. Those who were on a traditional plan and those who were on a high deductible plan had a similar sentiment. So I think that for me, seeing this question, while also sort of thinking back to those who are satisfied with their costs, even though their costs are a bit higher, I think that these are probably these folks who have some sort of willingness to stay with their plan. If everything else stays the same, they're sort of willing to accept a little bit of that increase in cost. So Alex, I'm going to turn it over to you.
Thank you. So this next section is questions on health and well-being. We asked respondents to assess their own health across 3 areas: their overall health, their physical health, and their mental health. So starting with this top bar, 60% rated their overall health as excellent or very good, which is up from 55% on the 2023 survey. When it comes to physical and mental health, the numbers are also pretty strong. 56% gave each of those areas a rating of excellent or very good. Those numbers are also up a few points from last year when it was around 52% for physical health and 50% for mental health. We also asked a trended question about sources of stress. Maybe not surprising given everything that's going on right now, but still worth calling out. The top three stressors are all tied to finances. So take a look at the first three bars here. 32% of respondents say inflation or the rising cost of goods causes them a lot of stress. Another 25% cite longer term financial concerns like saving money. And similarly, nearly 25% say paying for everyday expenses is a major source of stress. And then coming in close behind is stress related to work. People with high deductible health plans are more likely to report high levels of stress from both inflation and work compared to those with traditional plans. High deductible plan owners tend to be higher income uh, individuals over traditional plan owners. So I'm wondering if that might play a role here as well. Something that stood out to me here was that stress tied to caregiving and mental health actually had the lowest percentage of respondents saying they cause a lot of stress. That's especially interesting because this data was collected in fall of 2024. I'm not sure if other parents are aware, but that was right around the time when the Surgeon General issued an advisory labeling parental stress as a national mental health crisis. And I know around that time, attention was also called to mental health issues for other populations as well. So it's interesting to me that those are at the bottom. And that kind of leads us into this next point. We added a new question in 2024 about mental health care benefits. So on the left-hand side, this pie chart's showing that more than 80% of respondents believe that health insurance should offer the same level of benefits for mental health care as it does for other types of care, regardless of what type of plan they have. They all answered similarly, but if you look at this chart on the right, only 46% say their plan currently offers comprehensive mental health care coverage. So there's a gap between what people believe should be offered and what they're actually getting. Although there is a decent chunk of people who don't know what their plan is offering at all. And it's unclear what the reason is for their confusion. It's possible they haven't tried to use mental health care coverage, or maybe they're not really sure what qualifies as mental health care. So at some point, I'd love to go deeper there to kind of figure out where that gap is. So let's compare that to what people think about GLP-1 medications. And I know these drugs are all over the news lately, but just in case you're not aware, GLP-1s are a class of medications used to treat diabetes and weight loss. You'll see these normally marketed as brand names like Ozempic, Wegovy, Zepbound. Those are all GLP-1s. So we use that same question format here. And on the left, you can see that support for insurance coverage of GLP-1s is not quite as strong as mental health. 64% say insurance should cover them, but almost a quarter of respondents here say that they are still undecided. Compare that to mental health care, where we only saw about 8% that were unsure. I do wonder what is driving that uncertainty or that hesitation with forming an opinion about whether GLP-1s should be covered by insurance. Not sure if people just don't know what they are at all, or maybe they don't know like the name of the medication. We didn't use the brand name in the question, but we did describe that it's used for diabetes and weight loss. And then on the right-hand side, that pie chart showing only about 30% of respondents actually know whether their plan covers GLP-1s. So here we also have a very large group of people who are not sure either way. So for GLP-1s, it seems like there's a bigger knowledge gap. And since this class of drugs is projected to become even more widely used than it is now, it's something that we would want to dig into a little further, maybe via more research, because it's not only affecting consumers, but it's also affecting employers as they figure out how to manage the rising prescription costs of these drugs. This next section covers a few questions on technology. We have some telehealth questions and some smart health tech questions. So we'll start out with telehealth. Almost half of respondents say that either they or someone on their health plan have used telehealth services in the past year. And looking ahead, nearly 75% say that they're very or somewhat likely to use telehealth in the future. When we last asked this question back in 2021, only about 55% of respondents said the same. So we're clearly seeing a shift toward telehealth becoming a more accepted or maybe even a more expected part of healthcare. And then we asked people how important it is to have telehealth as an option. And most people said it matters to at least some degree. About half are saying it's very important or extremely important, but I want to call out this yellow bar in the middle. 32% of respondents say it's somewhat important. So I'm wondering if that's because people still think telehealth is primarily a tool for lower stakes or non-urgent appointments. And that's definitely something we'll want to keep an eye on as expectations around virtual care continue to evolve. So given that context, it's not too surprising to see broad agreement around the idea that health insurance plans should cover telehealth and in-person care equally. Nearly 90% of respondents agree with that statement. We're also seeing strong agreement that telehealth is a convenient way to access care, and most people are saying they trust the privacy and security of the information they're sharing when they're using telehealth services. An interesting finding here is this very last statement at the bottom. 70% say they prefer to use telehealth to see providers they already know. On the one hand, that's telling us that people value the convenience of virtual care, but relationships still matter. It's not just about saving time, but it's also about trust, familiarity, and continuity of care. But at the same time, that 70% is a little bit lower than the strong agreement levels that we're seeing for those other statements, which suggests there's still a sizable group who might be more open to models where they're matched with any available provider, like we tend to see with some of the larger telehealth platforms. So there's some people who still prefer speed, flexibility, ease of access over seeing a familiar face. We're going to shift gears a little bit and talk about smart health technology. That includes everything from blood glucose monitors to meditation apps to Apple Watches, Fitbits. I'm not sure if Fitbit is still a thing, but
think so.
smart scales, any kind of technology that tracks or supports your health. So more than 60% of respondents say they're either currently using one or they have used one in the past. I was actually surprised by the 37% who say they have never used any kind of smart health technology. And we do see a difference here based on insurance type. People with high deductible plans are more likely to be using these tools. 50% of high deductible health plan members are saying they currently use one compared to 40% of people on a traditional plan. Similar to the telehealth section, we asked a few questions about attitudes towards smart health technology. The second bar here shows that 67% either strongly or somewhat agree that they trust the data collected by their device is secure. That's lower than the 86% who say they trust the security of their data when using telehealth. That gap seems significant because it implies that although telehealth use might be a little lower than smart health use, telehealth might carry a built-in sense of credibility just because it's typically associated with clinical settings, licensed providers, whereas your smart health devices are typically, consumer brands that vary widely in their quality. And we see that play out here a little bit near the bottom. That 57% of respondents say that they question the accuracy of their data that they get from their smart health technology. So there's definitely an understanding that a lot of these smart health devices are imperfect tools, but still about 60% say that they would like to share that data with their doctor and with their insurance company. So I think maybe it's the idea that some imperfect data is better than nothing at all. Speaking of imperfect data and imperfect tools, about 60% of respondents say they're comfortable with smart health technology using AI. I would really love to see how that changes over time, especially as AI tools become more sophisticated and public understanding of AI data privacy and health tracking continues to evolve.
Yeah,
Go
I
ahead.
agree. Sorry, Alex, I was gonna say I absolutely agree with that point because I think, what we hear from AI and these tools, like it changes every day. So it'll be an interesting thing to track.
Yeah.
Well, does anybody have any questions or comments? Feel free to hop off of mute or to throw something sort of in the chat box. Either works. I'll give you all a second. I know sometimes I don't realize that I'm on mute. Okay. Well, if there's no sort of questions or comments that you right now, if you come up with any, feel free to reach out and we can, answer those for you. Like I said at the beginning, this is a pretty hefty report, so we have a lot of information to share. And with that, if you are interested in participating in the 2025 CEHS study, please feel free to reach out to us. By being a funder of that study, you have input on the questionnaire development and you receive the data and the findings before everybody else. So if you are interested in being a sponsor for the 2025 year, just please let us know. And then as we sort of end this and let you guys back into your day, I will say that if you are interested in watching any of the other coffee breaks that we've had that you may have missed in the past, we do have recordings of those so that you can watch those. And then I will end this by saying that, as you probably saw in our backgrounds in the top corner, this is Greenwald's 40th anniversary. So in addition to the coffee breaks that we usually have, we are also going to have some webinars throughout the year with some industry experts. And then in early November, I believe the 4th and the 5th, we will be having an in-person health and wellness symposium and anniversary celebration. So keep a lookout for further information about that. And again, for those webinars and other events and information that we will be having to celebrate our 40th year. And with that, again, thank you for spending your morning with us. I know it's sort of a rainy day here in DC. So enjoy your coffee or tea or whatever it is that you have this morning and have a great rest of your afternoon.